Hello, Dr. Muhammad Faisal to the MedEdge podcast. I welcome you here. Let's start with a brief introduction of who Dr. Muhammad Faisal is.
Okay, thank you very much. Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. I'm Dr. Faisal Khanani. I'm a Chief Division Pediatric Hematology working in Tawam. So I deal with the pediatric cancer and patient with the hematology disorder in Tawam.
Let's first understand what a day-to-day life of yours looks like.
As a physician life, our day-to-day life is always busy with the patient. So we seeing our patients in deal with the cancer patients or those who require transfusions in our clinics and in patients. So this is our daily life, treating a patients, seeing a patients and trying to help them and try to cure the all problems and be dealing with the patients and also the parents, which is also sometimes very difficult because if the kids diagnosed with cancer, it's difficult to even as a father or mother too.
Okay.
So we deal, this is our all daily challenges.
Okay. So you basically deal with the young souls who are suffering from cancer.
Yeah, which is pediatric.
Pediatric, yeah.
Which is from children's.
Okay. If you diagnose one particular kid with having cancer, how do you go about with it? Especially the parents and
Depend upon what cancer you're dealing with. But all cancer, the word of cancer is also difficult because to hear a child with common one is a blood cancer for children. So it's a different type of cancer. One is cure, one is, high risk or low risk. So we diagnose in a cancer and we sit with the family in an atmosphere where you have our coordinator and social worker try to support and we will disclose, but also the news is especially is, the patient is localized leukemia is not very high. Is the cure of leukemia, general acute lymphoid is 70-80%. Yes, this is a bad news, that patient, but the good news is that is a curable.
okay.
But the journey is again is nearly 2.5 years of cancer treatment for children, but not all in hospital. It will be like start way in the, but most of the time in the clinics to give chemotherapy. So this is this, and then family. Most of the parents are working class here, both mother and father,
Okay.
and so for them difficult to take a time. So they need some support. So we'll try to say that if they need any support, they can bring their families, try to look after the kids because for them also their jobs are affected. And so this is basically we start with a disclosure for a couple of hours and then again they answer the question. Initially it was shock, but again when they see other patients and families, those who got cured and they got more, enthusiastic to see that, okay, we have challenge now, we have to fight with it. And we do also annual cancer awareness and we do meet the families, bring the families, those who face these challenges and now, alhamdulillah, they are got cured. So this is the way we can try to meet the other families who face the same challenges and then
Make it a community sort of thing.
and that's why this is the way this go.
Okay. Pivoting to the parent side, what advice do you have for our audience who might be, God forbid,
See, first of all, childhood calendar cancer is again curable as hold together a different type of cancer from blood cancer to brain cancer. But to bring need attention early if they see any pick a sign, if child is limping, fever not going off, child getting a bruises or headache early morning and with vomiting, these signs, they need to be look after, not ignore them, get an early attention to as soon as you diagnose them, the cure rate will be high.
okay. So I understand as doctors, as physicians, it's a huge task for you to see such young souls suffering in your day-to-day life.
It's huge task and again is you get it's from Allah that He assign you to deal with this and then you deal with this not only as a physician, we have whole team of nursing which cannot be ignored because they are the one looking after these patients giving a chemotherapy and then you have a social worker, physiotherapist, everything.
How do you manage to keep them motivated and away from the burnout that occurs because of this particular scenarios that
The physicians or the
the nurses and who interact with them on a daily basis?
first of all, they are in this profession, the anyhow is also rewarding because you say, okay, you have these kind of patients, but we got this opportunity from Allah or God that, that we are in this and try to resolve because if you resolve or you can treat somebody who is in pain or who got this problem, and then you are helping other person as a physician or as a nurse to a patient. It's also rewarding to you. And we see our reward when you see the family and child got cured, because
Okay.
initially when they come to career is an issue. As soon as they pass, they see the child is curing and all the efforts. And anyhow, we do a yearly gathering where you see a patient who got cured. They see the rewards that the kids are grown up. They go to the colleges and the school, and later on, I'm in this profession now more than 20 years. And even some of the kids got married, they have their own family, and this is all rewarding. That okay,
That
this
satisfaction
the
in
satisfaction come because, and anyhow, the reward you will get in from here and hereafter in the other life. So this is the way you reward.
yeah. So, what inspired you to take this profession, and what would you advise the younger generation who are aspiring to take the same career path?
See, the career pathway, when you choose your career, again, you have your mentors in your life, which you do pediatrics and you inspire for somebody. So anyhow, I like to become pediatrician, and I inspire from my father-in-law and then as a pediatrician, and then I see that where is more rewarding and where you face the challenge and how you inspire it. So just to when you're in training and you got motivated in your training, to see other people, but then you come across to see us. Let's face this challenge, and initially it was a challenge, and then in the end is rewarding.
Okay. Thank you very much for shedding light on this particular domain of the medical industry.